Hodgkin's lymphoma is very sensitive to PD-1 inhibitors. And the preamble to this study is the KEYNOTE-204 study, which studied patients with relapsed Hodgkin's lymphoma that were ineligible for transplant or relapsed post-transplant, and were treated with either Pembrolizumab or brentuximab vedotin. And what we saw in that study is that Pembro as a single agent had an overall response rate of 65%, and a median progression-free survival of 13 months. So we wanted to build on that and see if we can improve on just using Pembro alone. LAG3 is also expressed in Hodgkin's lymphoma, and it's a checkpoint inhibitor. And Favezelimab is an inhibitor to LAG3. So the goal of this study was to study the combination of anti-LAG3 Favezelimab and Pembrolizumab in patients with relapsed Hodgkin's lymphoma that were not eligible for transplant. So the same population of patients that were studied in KEYNOTE-204. And these patients were treated with Pembro and anti-LAG3 every 3 weeks, using the same dosing for Pembro that we're accustomed with, until progression or a maximum of 2 years. And we studied 30 patients, and what we find is that the primary endpoint of the study was safety, and the secondary endpoint was overall response rate. And so what we find is that the overall response rate of patients treated with the combination therapy was 83% compared to the single agent historical control, 65%, and the median progression-free survival was 19 months. So this seems very promising, and importantly, the adverse events were seen of grade 3 and 4 in 27% of patients, and these appeared very manageable. So the most common adverse events were hypothyroidism and infusion-related toxicities, and these are very common toxicities that we can handle. So overall, it seems like a very promising therapy for patients with relapsed Hodgkin's lymphoma, with a very favorable safety profile, and I think it's a regimen that we could study in future patients.